So we're going to do a mobilization technique now for the head of the fibula. Now, any technique that we show you, obviously you need to assess for appropriately first to determine what the actual cause of the presentation is. Often what we see with this lateral knee pain through this lower compartment here, just below the knee itself, is that if we have tension from above, so tension from the ITB, TFL, glute max, or even vastus lateralis, pulling through this ITB complex down to its attachment down here below the knee, you can get jamming, compression, and sometimes pain in that lateral lower part of the knee. So if you place your thumb on the front of the head of the fibula, you can see the head of the fibula just here, place your thumb on the front, 2 fingers behind, make sure you do 2 fingers. 1 finger when you grasp it can be a little bit pinchy and uncomfortable. You can end up grasping the tendon of the lateral head of the gastrocs there. You don't want to compress that and create discomfort. So broader compression through 2 finger pads, and then the pad of the thumb on the front. You can do a quick assessment to identify whether or not the head of that fibula is moving freely through the joint. If you notice that it is quite stuck, often it'll be stuck in a posterior position because these structures are jamming and pulling it backwards. So just drag it forward. If you can feel that it's moving quite well, then you probably don't need to do this, but if it feels stiff and possibly painful with that oscillation, then a great technique to do is to just use those 2 fingers, hooking behind the bone, stabilize at the front, and then you can mobilize anteriorly, or if you need to, posteriorly, depending on which direction it's not moving well into. And so you'd spend good 30 seconds to a minute or so moving in one direction or the other, depending on what they need. What you don't want to do with any kind of mobilization is mobilize in multiple directions. The reason we don't do that is because the technique should be specific for their needs. So if we're mobilizing posteriorly and then anteriorly, we're not really trying to achieve anything specific. So make sure that you do your assessment, determine which direction it is limited in or potentially painful in, and then use that direction to guide the technique. Okay, so pushing posteriorly or pulling anteriorly, 30 seconds to a minute or so, go back, reassess, have them stand up, move around, see if they still have that stiffness or pain, and then continue with that technique if you need to. Obviously, this joint will be further improved in its mobility by reducing load on it. So working through in soft tissue techniques through this lateral thigh, through the lateral hip, trying to decrease tone through the lateral stabilizers and the quadratus, and the vastus lateralis will all contribute to a decrease in fascial tension, contributing to that stiffness through that lateral knee. So give that one a try as well.